Every year, hundreds of thousands of men receive a diagnosis that changes their lives: prostate cancer. It's a reality that many don't see coming until it's too late. But what if there were signs? What if your body was already sending signals, small warnings that something wasn't right? Wouldn't you want to know? Prostate cancer is one of the most common cancers among men, especially as we get older. The truth is, many early warning signs can be mistaken for everyday aging or minor inconveniences. A little trouble with urination here, a bit of discomfort there. It's easy to brush these off. But what if those small changes were your body's way of telling you that something serious was happening beneath the surface? That's exactly why this discussion is so important. As we age, taking care of our health becomes less of an option and more of a necessity. The conversations we have with our doctors, the way we listen to our bodies, and the decisions we make all play a role in how many healthy years we have ahead of us. The reality is, early detection saves lives. And the only way to detect prostate cancer early is to recognize the signs and take action when something doesn't feel right. In today's video, we're going to go over 9 early warning signs of prostate cancer that every man needs to know. Some of these might seem harmless, even ordinary, but they could be warning signals that should never be ignored. By the end of this discussion, you'll have a better understanding of what to watch out for, when to take action, and how to protect yourself or the men in your life from a condition that becomes more common with age. And here's something to keep in mind: knowledge is power, but action is what makes the difference. If you stay with us until the end, we'll also cover some key steps you can take to lower your risk and improve your chances of catching any potential problems before they become serious. Now, before we begin, if you haven't subscribed yet, now is the perfect time. Go ahead and hit that subscribe button and turn on the notification bell so you never miss an important health update. This channel is all about helping you stay strong, stay informed, and make the most of life's later years. We bring you expert-backed insights on health, mobility, nutrition, and overall well-being, so you can stay ahead of the curve and enjoy the years ahead with confidence. And we also want to hear from you. Have you ever noticed unusual changes in your health that made you wonder if something was wrong? Maybe you've experienced symptoms that seemed minor at first but turned out to be something more? Let us know in the comments. Your experiences matter, and your story might help someone else who's going through the same thing but doesn't realize it yet. So, let's get started. Sign number 1. Frequent urination, especially at night. Waking up once during the night to use the bathroom isn't unusual. But what happens when it starts happening twice? 3 times? Maybe even more? Imagine this. You finally drift off to sleep after a long day, only to be jolted awake by the urge to urinate. You make your way to the bathroom, relieve yourself, then crawl back into bed, hoping to fall asleep again. But just as you doze off, it happens again. And again. Before you know it, the night has passed, and you're left exhausted before the day even begins. Frequent urination, especially at night, might seem like just another part of getting older. But it could also be one of the earliest warning signs of prostate problems, including prostate cancer. The prostate gland sits just below the bladder, and as it enlarges, whether due to benign growth or something more serious, it can put pressure on the urethra, making it harder for the bladder to empty completely. The result? You feel like you need to go, even when there's not much urine left. At first, this might not seem like a big deal. You tell yourself it's just because you had too much water before bed. But if this starts happening regularly, if your sleep is interrupted night after night, it's time to take a step back and ask yourself, is this normal? Or is my body trying to tell me something? The first step is simple: start keeping track. If you find yourself getting up multiple times each night for no clear reason, jot it down. Keep a log of how often it happens and whether it's getting worse over time. If you notice a pattern, don't brush it off. Talk to your doctor about it. A simple conversation and a few routine tests could be the difference between catching a problem early and facing a more serious issue down the road. So ask yourself, how many times did you wake up last night? If the answer surprises you, it might be time to take action. Sign number 2. Difficulty starting or stopping urination. You step up to the toilet, ready to relieve yourself, only, nothing happens right away. You wait. Finally, a weak stream starts, but it doesn't flow smoothly. It stops, then starts again, then stops again. It's frustrating, uncomfortable, and sometimes even embarrassing. Sound familiar? This kind of difficulty, whether it's trouble getting started, an inconsistent flow, or struggling to fully empty your bladder, could be an early warning sign of prostate problems. Think of it like a faucet. When a faucet is working properly, water flows smoothly. But when there's a blockage or buildup inside the pipes, the water might trickle, sputter, or stop entirely. The same thing can happen with your prostate. The prostate gland surrounds the urethra, the tube that carries urine out of the body. When the prostate becomes enlarged, whether due to a benign condition or something more serious like cancer, it can press against the urethra, restricting the flow of urine. Over time, this pressure can make it harder to start urinating, cause unexpected stops midstream, and leave you feeling like you haven't fully emptied your bladder, even when you have. Now, occasional trouble urinating doesn't always mean something is wrong. But if this is happening frequently, if you notice a persistent change in your stream, whether it's weaker, slower, or more inconsistent than before, it's time to pay attention. The first step? Stay hydrated and monitor your symptoms. If this problem continues or worsens, don't wait. Talk to your doctor. A simple screening can help determine whether it's just an age-related change or something that needs immediate attention. If urination has become more of a struggle than it used to be, don't ignore it. Sign number 3. Blood in urine or semen. You finish urinating, glance down, and notice something alarming. Your urine has a pinkish or reddish tint. Your heart skips a beat. Maybe it's just something you ate, or perhaps it's a one-time thing. You tell yourself it will probably go away. But should you ignore it? Absolutely not. Blood in urine or semen, even if it only happens once, is never something to brush off. It's a clear signal from your body that something isn't right. In some cases, it could be the result of a minor infection or inflammation. But in others, it can be an early warning sign of something much more serious, like prostate cancer. The prostate is surrounded by a dense network of blood vessels, and when it becomes inflamed, enlarged, or cancerous, these blood vessels can become damaged. That damage can cause small amounts of blood to leak into your urine or semen. The tricky part is that this symptom isn't always accompanied by pain or discomfort. That's why so many men overlook it, assuming it's a fluke or something insignificant. But here's the reality. Blood in urine or semen is not normal. It's not something to wait and see about. Whether it happens once or multiple times, it's your body waving a red flag, urging you to get checked. If you ever notice even the faintest hint of blood where it shouldn't be, don't hesitate. Schedule an appointment with your doctor right away. It might turn out to be nothing serious, but if it is something more, early detection could make all the difference. When it comes to your health, it's always better to be safe than sorry. Sign number 4. Pain or burning sensation during urination. You head to the bathroom like any other day, but the moment you start urinating, a sharp, stinging sensation takes you by surprise. It burns, it's uncomfortable, and it doesn't just happen once, it keeps coming back. Many men assume this is just a urinary tract infection, something that will go away with time or a quick round of antibiotics. But what if it doesn't? What if that burning sensation is a sign of something more serious? Pain or burning during urination isn't just an inconvenience, it's your body signaling that something is wrong. In some cases, it could be due to an infection, such as prostatitis or a simple UTI. But when it persists, even after treatment, it's time to consider other possibilities. One of those possibilities is prostate cancer. When cancer develops in the prostate, it can cause inflammation and irritation in the surrounding tissues, including the urethra. That inflammation can lead to a painful or burning sensation when urinating, similar to an infection but without the usual bacteria to blame. This is why many men delay seeking help, thinking it's a minor issue that will clear up on its own. But waiting too long could mean missing an early warning sign. If you experience persistent burning when you urinate and antibiotics don't resolve the issue, don't just accept it as normal. Ask your doctor for a PSA test, a simple blood test that can help detect potential prostate issues, including cancer. Early detection is key, and addressing the issue now could make all the difference in protecting your long-term health. Pain during urination is not something to ignore. Sign number 5. Erectile dysfunction, ED. You've probably heard that erectile dysfunction becomes more common with age. A man in his 60s or 70s might assume that occasional difficulties in the bedroom are just part of getting older. But what if there's more to the story? What if, instead of just age-related changes, this was actually an early warning sign of something happening inside the body, something like prostate cancer? Erections rely on a delicate balance of blood flow, nerve function, and hormone levels. The prostate sits right next to key nerves and blood vessels involved in sexual function. If something starts affecting the prostate, whether it's inflammation, enlargement, or cancer, it can interfere with those pathways, making it harder to achieve or maintain an erection. The problem is, most men don't connect the dots. They think, maybe I'm just stressed. Maybe it's low testosterone. Maybe it's just normal aging. And while those things can contribute to erectile dysfunction, a sudden or worsening change in sexual health should never be ignored. If you've noticed a decline in erectile function that seems different from the occasional off night, especially if it happens alongside other urinary symptoms, it's worth bringing up with your doctor. A conversation about sexual health might feel uncomfortable, but it could be one of the most important talks you ever have. So here's the key takeaway. Don't dismiss changes in sexual health as just aging. If something feels different, if ED has become a persistent issue, or if it seems to have come out of nowhere, take it seriously. Sign number 6. Pain in the lower back, hips, or thighs. Back pain. It's something almost every man experiences at some point, especially as the years go by. Maybe it's from an old injury, maybe it's from sitting too long, or maybe it's just the normal wear and tear of aging. But what if the pain isn't just muscle stiffness or arthritis? What if it's something deeper? Prostate cancer, especially in later stages, can spread to nearby bones, including the lower back, hips, and thighs. When this happens, it often causes a persistent, deep, and aching pain, different from the kind of soreness you might feel after a long day or a bad night's sleep. This type of pain doesn't go away with rest, stretching, or over-the-counter painkillers. It lingers, sometimes getting worse over time. At first, it's easy to dismiss. After all, back and hip pain are incredibly common. But here's what makes this kind of pain different. It's dull, deep, and persistent. It doesn't change much with movement, and it doesn't go away with simple treatments. If you've noticed unexplained pain in your lower back, hips, or thighs, especially if it's been around for a while and isn't linked to an obvious injury, it's time to consider getting checked. A simple PSA test can help detect prostate cancer early, giving you a better chance at effective treatment. Pain is the body's way of getting your attention. If your lower back, hips, or thighs are aching in a way that doesn't feel normal, don't just chalk it up to aging. Listen to what your body is telling you and talk to your doctor. It could make all the difference. Sign number 7. Unexplained weight loss. You step on the scale and do a double take, another few pounds gone. At first, it might seem like a good thing, especially if you weren't trying to lose weight. But when the pounds keep dropping without any changes to your diet or exercise, it's time to ask, why is this happening? Unexplained weight loss is one of the more subtle warning signs of cancer, including prostate cancer. When cancer is present, the body can start burning calories at a faster rate, even when you're eating the same amount as before. The immune system and metabolism shift as the body tries to fight off the disease, sometimes leading to noticeable weight loss in a short period. Many men don't think twice about losing weight, especially if they've been carrying a few extra pounds for years. But if the weight is coming off without any effort, if your clothes are fitting looser, the number on the scale keeps dropping, and you have no explanation, it's time to take action. Start by keeping track. Weigh yourself once a week and make note of any changes. If you've lost 10 pounds or more in a short time without trying, schedule a checkup. Your doctor can run tests to rule out potential causes, including a simple PSA test to check for prostate health. Weight loss might not seem like an obvious warning sign, but when it happens unexpectedly, it's a clue that something might be going on beneath the surface. Don't ignore it. Sign number 8. Chronic fatigue or weakness. You wake up after a full night's sleep, but instead of feeling refreshed, you feel drained, like you barely slept at all. As the day goes on, simple tasks feel exhausting. Walking up the stairs leaves you winded. Even sitting for long periods makes you feel wiped out. You tell yourself, maybe I'm just getting older. Maybe I need more coffee. But what if it's something more? Chronic fatigue isn't just about feeling tired, it's a deep, persistent exhaustion that doesn't go away with rest. One possible reason? Anemia, a condition where the body doesn't produce enough healthy red blood cells to carry oxygen. In some cases, prostate cancer can lead to anemia, leaving you feeling weak, sluggish, and constantly low on energy. At first, fatigue might be easy to dismiss. After all, life can be tiring, and everyone has days where they feel off. But if you've noticed a pattern, if you're feeling consistently weak, struggling to get through daily activities, or finding that even small efforts drain you, it's time to pay attention. Listen to your body. Fatigue isn't just part of aging when it starts interfering with your normal life. If you're feeling persistently weak or run down, schedule a checkup. A blood test can check for anemia, and a PSA test can help rule out prostate issues. Don't ignore a body that feels constantly exhausted. There could be an underlying reason, and catching it early could make all the difference in your health and quality of life. Sign number 9. Change in bowel movements. You've had your routine for years. You know what's normal for your body when it comes to digestion. But lately, something feels off. Maybe you're suddenly constipated more often, or you're experiencing diarrhea that doesn't seem connected to anything you ate. Perhaps your bowel movements feel different, more strained, incomplete, or unpredictable. Most people associate bowel issues with diet, stress, or common digestive problems. But what many don't realize is that prostate cancer, especially in more advanced stages, can also play a role. When a tumor grows large enough, it can press against the rectum, affecting bowel movements and causing noticeable changes in digestion. At first, these changes might seem small. Maybe you're just feeling a little bloated or struggling to go as easily as before. But if constipation, diarrhea, or other unusual bowel habits persist without a clear explanation, don't brush it off as just one of those things. Your body could be signaling something more serious. If you've noticed a pattern of unexplained changes in your bowel habits, pay attention. Keep track of any ongoing irregularities and don't hesitate to bring them up with your doctor. A screening test, including a PSA test, can help determine if your prostate is the underlying cause. When it comes to your health, no symptom is too small to investigate. If your body starts acting differently, especially in ways that persist over time, don't ignore it, get screened. It could be the step that saves your life. Each of these symptoms on its own may not necessarily mean cancer, but when they persist or appear in combination, they could be an early warning sign that something isn't right. The most important takeaway is this: early detection saves lives. Prostate cancer is highly treatable when caught early, but if left unchecked, it can spread and become much harder to manage. Unfortunately, many men dismiss these symptoms, attributing them to aging, lifestyle changes, or minor health issues. But waiting too long to get checked could mean missing the opportunity to catch the disease in its early stages. That's why awareness is critical. By recognizing these warning signs and taking action, you're giving yourself the best possible chance for early diagnosis and effective treatment. If you or a loved one have experienced any of these symptoms, don't ignore them. Schedule a checkup, ask about a PSA test, and have an open conversation with your doctor. It's not about worrying unnecessarily. It's about taking control of your health before a small issue turns into a bigger one. Now, we want to hear from you. Have you or someone you know ever dealt with any of these symptoms? What steps did you take? Share your thoughts in the comments below. Your story could help someone else who might be going through the same thing. And if you found this video helpful, don't forget to give it a thumbs up and share it with friends, family, and loved ones. Spreading awareness can truly save lives. If you haven't already, hit that subscribe button and turn on the notification bell. We share essential health tips that help you stay strong, informed, and in control of your well-being. Your health is your wealth. Stay informed, stay proactive, and take charge of your future. Until next time, stay strong and stay healthy.